Welcome to Boston University Medical Center's Rheumatology Fellowship Program. I'm Dr. Kissen, the Program Director, and I'd like to give you an overview of our program. Here, we'll give you a broad clinical training in rheumatology. Our training is based on our patients, and our patients come from the indigent population whom we serve, as well as patients from the VA hospital. Our patients come from all over the world, increasing your experience with all sorts of diseases. We get secondary referrals for our derm room clinic and our lupus clinic, and we get tertiary referrals to our extensive clinical trials program. And we draw patients from all over the Northeast and, in fact, from all over the country. In addition to our great patient population, we have a dynamic clinical training program that includes in-depth instruction in musculoskeletal ultrasound use, that includes didactics and hands-on experience. You will have multiple opportunities to learn from 4 faculty members, facile with the technique, and easy access to equipment. I have 17 years of experience in musculoskeletal ultrasound, and you will have access to me, and I'll teach you how to use the technique. We will teach you anatomy, not just through ultrasound, but also through extensive year-long program in musculoskeletal x-rays. So you'll learn how to read plain films as well as a regular radiologist. You'll have 3 clinics each year. These will include a fellow-based clinic and faculty-based clinics. Thus, you'll have a good balance between autonomy and experience in subspecialty referrals and guidance from faculty who are leaders in their fields. Finally, you'll have the opportunity to learn research in a structured environment through both didactics on study design and through clinical and basic science research meetings, depending on your interests, as well as through mentorship, which is the most important. We have one of the most productive research departments in the country for a faculty our size, about 12 to 14 members. It's neither too small, limiting opportunities, nor too large, where fellows can get lost. We expect our fellows to perform research and to publish their results, and all of our fellows meet these goals. As Program Director, I've created a collection of literature articles paired with case discussions to cover the broad array of rheumatic disease topics. I've guided our faculty to create a rheumatology question bank to help prepare you for your future practice and for the rheumatology boards. In addition, I've instituted a practice of recording teaching points and constructive feedback from each fellow clinic to help reinforce what has been taught and to make sure that there are no gaps in our teaching. Fellows coming from BUMC are known for the thorough knowledge of all aspects of rheumatology, skill in performing joint and soft tissue injections, as well as expertise in both the use of musculoskeletal ultrasound and their ability to independently evaluate plain films of bones and joints. Next, I'd like to introduce you to our section chief, Tahina Niogi. Dr. Niogi is an international superstar, having become a leader in the worlds of gout, calcium pyrophosphate crystal disease, musculoskeletal pain mechanisms, osteoarthritis, and clinical and epidemiologic research in general. Just to give you a flavor for her remarkable abilities, she was quickly able to get a big grant for COVID-19 related research to help bolster our division's financial security during the strains of COVID. She was the first person to get an RTC trial up and running for COVID-19 at our institution, even before the ID folks. Not surprisingly, she has had continuous peer-reviewed foundation and NIH funding since 2003 and has more than 200 publications to date. She's received awards for her skills at mentoring trainees in clinical research, and without further ado, Tahina.
Hi, my name is Tahina Niogi, and I'm the Chief of Rheumatology at Boston University School of Medicine, Boston Medical Center. I'm here today to talk to you about how our faculty are involved in fellowship training. The most obvious way in which our faculty are involved is in clinical training. All of our faculty have their own clinics that the fellows rotate through, and this is in addition to the fellow clinic where the fellows are responsible for their own patients. In our faculty's clinics that the fellows rotate through. Many are specialty clinics. And this offers the fellows an opportunity to have a concentrated exposure to certain diseases, for example, like scleroderma, lupus, etc. Our faculty also attend on the inpatient service, so our fellows each get to be exposed to different styles in the inpatient service when the different attendings are on with the fellows. The second obvious way in which our faculty are involved in training is through the didactic sessions. So Dr. Jean Kissen, our program director, oversees the didactic program, and all of our faculty attend the Wednesday morning case conference. This case conference is very well attended by our fellows and faculty, and often other people outside of the section as well. Everyone is very involved, and we have a very nice style in our case conference. It is not an eminence-based discussion by the most senior faculty. We have a very egalitarian approach to these case conferences where everyone contributes, not just the most senior people, and the fellows run that session. We have different faculty who are in charge of different aspects of didactic sessions. For example, there's someone in charge of the journal club, radiology rounds, physical exam, board review, injection techniques, etc. So we have a very robust educational system that the faculty oversee. And I think the third aspect in which faculty are very involved in fellow training is one of our strengths, and it's a unique strength at our institution. Many of our faculty are nationally and internationally renowned researchers in their variety of areas of research expertise. And we take that research expertise and provide a very formalized research training program, which is unique in this country. We have a fellow research training committee that oversees the fellow research program. In the beginning of each academic year, the faculty present their research in grand rounds, and then the fellows are invited to meet with faculty one-on-one based on their research interests. The fellows then decide on what projects might be of interest to them, and then they present their research ideas to the whole section. And the fellow research training committee provides feedback on quality of the science, feasibility, like can you get it done in the time course of your fellowship, and we have an end goal in mind that we want you to use your time doing research to get something that is publishable, getting an abstract out there, getting a paper out there. With this, once a project is settled upon, we have a multidisciplinary team of people that help you get your project done from beginning to end, whether it's lab assistants, research assistants, project managers, programmers, biostatisticians, epidemiologists. We meet to help you design your study, carry it out, and give you feedback along the way. I personally meet with fellows on a quarterly basis to see how things are going, check in, but my door is always open. You can always come and talk to me about any questions or issues that may arise, as you can with any of our faculty. We also help with networking opportunities for research and for jobs. So we look forward to inviting you to come and meet with us, answer your questions, and we hope that we can help you on this journey to the next step of your career. And now I have the pleasure of introducing Dr. David Felsen, who is one of our internationally renowned osteoarthritis researchers. He's going to talk to you about the research opportunities during your fellowship.
Welcome to the Boston University Rheumatology Fellowship Program, where we have a strong research component that I'd like to tell you about. For a long time, we've trained fellows who have succeeded in carrying out research that they publish, that they present at scientific meetings, and these often lead them to faculty positions both at Boston University and at Harvard and Yale and the Mayo Clinic and other leading institutions. Even in your first year, you will be exposed to and get involved in research, starting with a journal club once a week, and then participating in your own research projects with strong mentorship teams. In the first year, you'll have an opportunity to meet with all the potential mentors and try to decide what you'd like to do for your research. There's strong laboratory research led by Dr. Trojanowska doing scleroderma and fibrosis research. There's a variety of other opportunities here at Boston University to work with those who do regenerative medicine, those who do bioinformatics, and other exciting new technologies that relate to research. And then there's the clinical research program, which is among the strongest in the country, if not in the world. Diseases we study in the clinical research program include scleroderma, gout, spondyloarthritis, lupus, ultrasound studies, and especially osteoarthritis. Every fellow who engages in research has weekly meetings as part of the lab. And in the clinical research group, we have weekly readings we call the rescue meetings, which are attended by all of our clinical research faculty, including myself and Dr. Mioji and Dr. Dubroyo and others, a statistician, an epidemiologist, programmers, and physical therapists who work closely with us in our research program. Each fellow entering into the research program finds a mentor that helps them, that sponsors them, and that they meet with regularly. And there's also a team of mentors that they work with. We also have a leading school of public health that many of the clinical research wind up taking courses at that school. And they participate in the clinical research training program here at Boston University, which is oriented toward training fellows in subspecialty areas to be successful in carrying out research projects and to enter into research careers. Lastly, we've developed a nascent partnership with the Beth Israel Deaconess Fellowship Program at Harvard so that we trade fellows, and some fellows may have the opportunity to carry out their research with mentors in that program. Now I'd like to introduce Dr. Maureen Dubroyo, one of our faculty members, who will talk about opportunities at the VA.
Hello, my name is Maureen Dubriel. I'm an assistant professor in the rheumatology section. Thank you for your interest in our fellowship program. I'm one of the core faculty in the program, and I have a clinical and research focus in spondyloarthritis, including psoriatic arthritis and ankylosing spondylitis. I have a few roles where in particular I interact with the fellows. I am the VA clinic site director. So in this clinic, as a fellow, you'd have a continuity clinic, so patients would be directly scheduled with you over the course of your year-long clinic. This clinic has a fairly high volume of procedures, so you'd have the chance to practice and learn procedures there. And then I help to teach fellows ultrasound through this clinic, which really complements the teaching that's done at the BMC clinic. I'm a preceptor for the Fellowship Journal Club, and this journal club is focused on methodology. So over the course of a year, we review several different study designs. The fellow typically picks a paper for this journal club, brings it to me or one of the other preceptors for an in-depth discussion, where we review the study methodology, the merits and shortcomings of that methodology, how the results are presented, and how to interpret those results, and then whether the study conclusions match the study results well. And then I help to moderate the discussion during the journal club presentation. I'm also the director of research training through the fellowship program. As a fellow, you'd be asked to participate in an academic or research project over the course of your fellowship. So I meet with fellows early during their fellowship and help them pick a project and help them to establish a primary mentor. I then touch base with the fellows fairly frequently regarding the research project to understand how it's going and help them to overcome any obstacles. We ask that fellows also present their academic or research work as either an abstract or a paper, so I help with that as well. As I mentioned, I'm doing research in spondyloarthritis, and I'm funded by an NIH K23 award and an RO3 award. I study at the moment risk of joint replacements and risk of fractures in spondyloarthritis related to treatment, and also study cost effectiveness of spondyloarthritis treatment. I have mentored several fellows over the past years, including some fellows that have done research in spondyloarthritis as well as other topics. So I look forward to the chance to meet you. Please let me know if you have any questions. Next, I'd like to introduce my colleague, Dr. Jean Liu.
Hi, I'm Jean Liu. I joined the BU faculty in July 2020 after I finished my fellowship training at the University of Washington in Seattle. Currently, I split my time between clinical research and clinical care and teaching. My 3 areas of research focus are in osteoarthritis, axial spondyloarthritis, and the intersection of COVID-19 and rheumatic disease. I was fortunate to have been able to train in clinical epidemiology, completing a 2-year master's program during my fellowship. I have continued my interest in axial SPA and COVID-19, which I developed during my training, as well as started focusing on observational studies of OA and OA pain, utilizing data from the Multicenter Osteoarthritis or MOST study, for which BU is the primary data analytics site. As a recent fellowship graduate, I understand the decisions you're facing as you look for a program that provides the right fit and which aligns with your goals. Some of the data that you'll be looking for are where former rheumatology fellows have wound up and what sorts of careers they've pursued. So where have rheumatology fellows gone after training? Several of our fellows have become faculty here at BU. Others are faculty at Tufts, MGH Brown, NIH NIAMS in the Mayo Clinic. Many have gone on to work in community practice, either staying in New England or going as far afield as Japan and Iceland. And still others have gone into industry working on clinical trials. If you would like to hear more about some of these paths that prior fellows have taken, please don't hesitate to ask. And now I would like to introduce our next speaker, Dr. Andrea Bujor, a clinician scientist focusing on fibrosis and systemic sclerosis.
Hello everyone, and thank you for your interest in our fellowship program. As a former BU fellow, I can attest this is an outstanding program. One of the learning opportunities that we offer our first-year fellows is their own continuity clinic. Every Friday morning, we meet together and see a panel of patients that will become your own. Fellows see an average of 2 new and 4 follow-up patients on a clinic day. You would be responsible for the longitudinal care of this panel of patients through your first year of fellowship. As the supervising attending for the Fellows Clinic, I will provide you with oversight and guidance through this process. We will discuss together each individual case and help you identify key elements of history and exam that will help you formulate a pertinent differential diagnosis. You would also become familiar with the appropriate management and testing strategies. The discussion goes beyond the clinic, and so does the teaching, as we often meet on an informal basis to continue this discussion about most interesting cases. I enjoy a lot the interaction with the fellows, as it not only gives me the opportunity to teach, but also to learn side by side with them every day. I am looking forward to the opportunity to spend time learning together should you match to our excellent program. And now please allow me to introduce Dr. Michael York.
One of the great things about training at Boston University is that we can offer you so many different opportunities to pursue your interests, even if it takes you to other departments within Boston Medical Center or over to other institutions in Boston. We've had a few fellows who've had an interest in sarcoidosis, and they've worked in our pulmonary section in sarcoidosis clinic. Another fellow was interested in IgG4 related diseases, and we were able to offer her the chance to do a clinic during her second year with Dr. John Stone at Mass General Hospital in his IgG4 related disease clinic. We've had clinically oriented fellows who've wanted some exposure to pediatric rheumatology, and we've had them do rotations with Dr. Ezra Cohen, our pediatric rheumatologist, or do rotations over at Children's Hospital. In terms of research opportunities, you've heard about our clinical epidemiology program as well as basic science training, but Boston University also offers a chance to get a master's or a PhD in the bioinformatics program, which is run through this College of Engineering. This is the study of stem cells, post-genomic modifications, gene expression, and the study of complex biological systems. Two of our fellows have done this and gone on to great success in research. It's really a wonderful opportunity. Now I'd like to introduce Dr. Monica Crespo-Bosk, who is going to talk about diversity within our program and in our patient population. Dr. Crespo-Bosk is a native of Puerto Rico. She came to Boston initially to go to MIT for undergraduate years and then went to Harvard Medical School. She stayed on to do our Boston University internal medicine residence training and then did her fellowship over at Johns Hopkins, but we were able to entice her back here. her clinical interest is lupus. Thank you.
Hi. While it can be hard to summarize what makes our program special, I would like to highlight a few aspects that distinguish us. First of all, I don't think I could talk about the BU Rheumatology Fellowship Program without talking about the patients we have the privilege to serve. As you may know, Boston Medical Center serves as the safety net hospital for the city of Boston. And as such, we serve a predominantly inner city patient population, very ethnically diverse and largely underserved. Many of us chose to be at BU and BMC because of its mission. As a trainee, you will find that you'll be exposed to the full spectrum of rheumatologic diseases, and you'll be seeing patients coming in at all stages. In terms of the community in general, BU and BMC are very welcoming and nurturing environments. You'll find that in our staff and faculty. You'll have plenty of access to mentorship and guidance as you choose areas of interest for research and as you plan your future career plans. For the more structured curriculum, we have a robust musculoskeletal ultrasound program led by Dr. Kissing, our program director. 4 of our faculty are trained in ultrasound, and our fellows really have ample access to use the ultrasound machines in our clinic. Something that's very different at BU is that our fellows have the opportunity to have hands-on experience with and in doing injections, supervised injections in the cadaver lab, and this happens on a yearly basis. For the more regular teaching, they have weekly sessions which include x-ray teaching as well as case-based discussions where our fellows lead us through some interesting cases they see in the consult service. And these serve as a great opportunity to interact with our faculty who are very engaged and actively participate of these sessions. Just speaking a little bit more about our faculty, there's currently 19 of us, will be 20 come July. 13 of us are clinical, with 7 being research faculty. We're 9 women and 11 men. We have a wide spectrum of areas of interest, ranging from scleroderma, lupus, osteoarthritis, psoriatic arthritis. And this really enriches the experience of our fellows who get to learn from each of our areas of interest. So now I will leave you with Dr. Marcin Trojanowski, who will talk to you about how we collaborate with other groups at BMC and BU. Thank you.
Hi, my name is Marcin Trojanowski. I'm a junior faculty here at BU in rheumatology as well as the clinical director of the rheumatology clinic. I want to tell you about some of the collaborations we have with our peers in the rest of the hospital and university. As you know, inflammation and autoimmunity touch so many organ and systems that collaborations between different subspecialties is absolutely vital. One of the closest collaborations we have is with dermatology. We run a monthly clinic with rheumatology, dermatology, and nephrology for our lupus patients to optimize our care. It's also a terrific learning resource for our fellows. With dermatology, we also have a general weekly rheum derm clinic where the rheum derm specialist houses with our rheumatologists and rheumatology fellows and dermatology residents, a clinic that sees all kinds of patients from systemic sclerosis, dermatomyositis, lupus, psoriatic arthritis, a drug eruption, leprosy, everything. I can't tell you how much I've learned in that clinic, much more than I ever did in training. We've also, from an academic standpoint, have expanded our collaboration with dermatology and have this past few years done a 1-month grand round style alternating education lecture conference. In each of these, the particular group, such as dermatology and rheumatology, will educate the others about topics that may be second nature to us, but tricky to our peers. So, for example, the dermatologists have recently lectured us on facial rashes versus oral ulcers versus topical medicines. Once again, extremely helpful and something that you don't typically get in rheumatology training. Because of our historic emphasis on systemic sclerosis, we also have a very close tie with our pulmonary colleagues. We have a monthly interdisciplinary meeting with pulmonary and radiology to discuss the most significant interstitial lung disease cases, review images, discuss treatments. This has stimulated recently a grand rounds for the entire Department of Medicine, and there's several research questions that are forming from the cross-pollination that we get in these meetings. We also are working with our PAH colleagues, both in pulmonary and in cardiology, on several research projects, data mining the extensive scleroderma patient cohort that we have and biorepository. So, as always, our pulmonary interactions remain as strong as ever. There are many more to come. We hope to, in the future, develop an interdisciplinary pain clinic. That's being spearheaded by our leader, Dr. Nioji, and it's in its final phases of development. Pain is an increasingly problematic issue for the population as a whole, but in BMC's population in particular. And once again, that will be a tremendous resource for our trainees that rotate through this program. Thank you.